Well, my name is Kim Young. I'm a hematology nurse at Mayo Clinic with Dr. Kumar, and I specialize in the myeloma group. I'm going to talk about symptoms of myeloma itself and how we treat some of the side effects that occur with the therapies that we use. As far as the myeloma itself, in our bodies, a normal cell rapidly matures and dies, and this process will repeat itself over and over. A normal plasma cell produces antibodies that will help your body. With multiple myeloma, there is an overproduction of these harmful antibodies, and they rapidly multiply, but they don't die off. And so this causes a crowding of the healthy cells. The excess abnormal plasma cells will spill out of the bone marrow and can spread throughout the body. So early on, a patient may have no symptoms. Typically, myeloma is coincidentally discovered by blood work or imaging that's being performed for another reason, such as a patient goes in with back pain and imaging happens to show that there's lesions on their spine. Symptoms aren't always there at the very beginning. So some people remain smoldering or have the mucus, like Dr. Kumar discussed, for many years, and they don't require active treatment. They just require monitoring. Others who have active disease and are symptomatic may need to start treatment right away. So the best way to treat the symptoms of myeloma is to start therapy right away with chemotherapy. And as the number of myeloma cells are killed off, the symptoms should then start to improve. So symptoms of myeloma itself, I'm going to move forward to this diagram that I like. So with our myeloma patients, we see usually they present with anemia and thrombocytopenia, which means their hemoglobin is low and their platelet count is low. As I discussed, that crowding of the healthy cells, they get destroyed easily, and that causes low hemoglobin and low platelets. So those patients will notice a lot of fatigue, shortness of breath, and bruising from the low platelet count. Fatigue is another common symptom that a lot of people overlook. The body has to work a lot harder to fight infections because the helpful antibodies are in low supply. So, and also the low blood counts cause fatigue itself. Frequent infections, the good antibodies that fight infections are in low supply. So myeloma patients are at a much higher risk for getting infections. Most myeloma patients will have bone pain or fractures or weakened bones. Those are most commonly seen in the spine, the ribs, and the hips. And again, patients will come in saying they have back pain that won't go away, and that's when the myeloma is typically found. There can be lesions in the spine, lesions in the ribs, and that causes the pain. And they can also cause fractures within the bones where the lesions are. Kidney damage, so a lot of myeloma patients do come in with kidney damage of some sort. The abnormal proteins from the myeloma build up and clog the kidneys, and so the kidneys aren't allowed to filter waste properly. And then that leads into increased calcium. So we will see a lot of increased calcium in our patient population. The calcium is pushed from the bone marrow and enters the bloodstream, and then that affects the kidney's ability to filter. And so increased calcium, we'll see extreme thirst, frequent urination, dehydration, constipation, confusion, loss of appetite, those sort of symptoms. Some of our patients also have nausea and vomiting, dizziness, swelling, bruising, and weight loss, just in general